Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The activity measure for post-acute care assesses a patient's functional status in performing daily activities across various healthcare settings. It measures mobility, self-care, and basic physical activities. The tool is designed to evaluate changes in functional ability among patients with neurological conditions, musculoskeletal disorders, and post-surgical recovery. Its main purpose is to guide clinical decision-making, track rehabilitation progress, and support outcome measurement in post-acute care populations. The assessment provides standardized data to improve patient management and resource allocation in rehabilitation services. The activity measure for post-acute care is designed for adult patients receiving rehabilitation across diverse clinical settings. It is particularly indicated for individuals with neurologic conditions such as stroke, spinal cord injury, and traumatic brain injury. The measure is also relevant for populations undergoing post-surgical rehabilitation and those with chronic medical conditions affecting functional status. Its clinical utility is greatest in post-acute care environments, including inpatient rehabilitation facilities, skilled nursing facilities, and home health care. The tool facilitates objective assessment of functional change over time, supporting care planning and outcome evaluation. Validity and reliability have been demonstrated in heterogeneous patient populations, making it a robust measure for tracking activity limitations during recovery phases. The activity measure for post-acute care consists of 36 items organized into 3 domains: basic mobility, daily activities, and applied cognitive. Each item evaluates the patient's difficulty in performing specific functional tasks. The response format employs a 4-point Likert scale indicating the level of difficulty, ranging from no difficulty to unable to perform. To administer the tool, the clinician reads each item aloud and records the patient's self-reported ability on the scale. Scores for each domain are summed and transformed using the standardized scoring algorithm to yield scaled scores ranging from 0 to 100. Higher scores reflect greater functional independence. Reference values based on normative data suggest that scores above 85 indicate minimal impairment, scores between 65 and 84 denote mild to moderate limitations, and scores below 64 indicate significant functional deficits. Careful comparison with age-matched peer groups is recommended to contextualize results. Interpretation should consider the clinical setting and patient goals to guide rehabilitation planning. The activity measure for post-acute care demonstrates a reported sensitivity ranging from 0.8 to 0.9 in identifying patients with functional impairments. Sensitivity refers to the measure's ability to correctly detect individuals who have reduced activity levels, minimizing false negatives. Specificity values for the tool generally range between 0.75 and 0.85, indicating its effectiveness in correctly classifying patients without significant functional limitations and reducing false positives. For example, a sensitivity of 0.85 suggests that 85% of patients with actual activity limitations are identified accurately by the tool, which is critical in post-acute care settings for timely intervention. Similarly, a specificity of 0.8 means that 80% of patients without impairments are correctly recognized, preventing unnecessary treatments. These metrics support the tool's clinical utility in assessing patient function across various post-acute care populations. The activity measure for post-acute care was developed in the early 2000s by researchers at the Boston University School of Public Health to address limitations in existing functional assessment tools across diverse post-acute care settings. Validation studies conducted during its initial development phase demonstrated strong content validity through expert panel reviews and patient input to ensure comprehensive coverage of relevant activity domains. Subsequent psychometric evaluations revealed high internal consistency reliability, with Cronbach's alpha values exceeding 0.9 for the core functional domains. Construct validity was supported by significant correlations ranging from 0.6 to 0.8, with established measures such as the Functional Independence Measure and the Barthel Index. Additionally, responsiveness to change was demonstrated in longitudinal studies involving rehabilitation patients, where activity measure for post-acute care scores reflected clinically meaningful improvements in function over time. Cross-validation in different patient populations, including stroke, orthopedic, and pulmonary rehabilitation groups, further confirmed the tool's generalizability and robustness. Rash analysis was employed to refine item calibration and scaling properties, resulting in interval-level measurement suitable for both clinical and research applications. These collective findings provide a rigorous scientific foundation underpinning the use of the activity measure for post-acute care as a reliable and valid instrument for assessing functional status in post-acute care settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.